Bathing, the bedbound resident procedure for bed bath. Bed baths are given to residents who can't get out of bed for reasons that may be either temporary or permanent. The resident's entire body is washed one part at a time. The bath is usually given after elimination has occurred and is given along with oral care and a change of bed linens. To avoid irritating the resident's skin, always pat with the washcloth and towel. Don't rub. 1. Place the resident in a supine, lying down, position and cover with a blanket. 2. Remove the resident's clothing, keeping him or her covered with the blanket. 3. Assemble equipment, basin, washcloth, soap, gloves, towel, and fill the basin with warm water. The water temperature should be between 105 and 110 degrees. 4. Put on disposable gloves. Place a towel over the resident's chest and blanket. 5. Wet the washcloth in the basin and form a mitt around your hand with the washcloth. 6. Wipe the resident's eyes with the washcloth and clear water, using a different corner of the mitt for each eye so you don't spread infection. Wipe each eye gently from the inside corner out. 7. Apply soap to your washcloth mitt. Wash the face, neck, ears, and behind the ears with the soapy mitt, then rinse and pat dry. 8. Place a towel under the resident's forearm and wash the arm, shoulder, and underarm with a soapy mitt. Support the resident's elbow as you wash the arm. Rinse and pat dry. 9. Put the basin on the bed and place the resident's hand in the water. Wash the hands and between the fingers with soap and water. Clean under the fingernails carefully. Dry the hand and cover the arm with the blanket. Repeat steps number 8 and number 9 for the near arm and hand. 10. Pull the blanket back to the waist and cover the resident's chest with the towel. Lift the towel to wash the chest with a soapy mitt. Rinse and pat dry. Wash, rinse, and dry thoroughly under the female breast. 11. Repeat for the abdomen, keeping the resident covered everywhere besides the abdomen. 12. Place a towel under the far leg. Support the leg under the knee while washing, rinsing, and drying. 13. Wash the foot and between the toes in the basin, dry thoroughly, and cover the leg with the blanket. Repeat steps number 12 and number 13 for the near leg and foot. 14. Change the bath water. Turn resident on side, facing away from you. Put a towel on the bed beside the back. Uncover the back and buttocks and wash, rinse, and dry from neck to buttocks. 15. Provide perineal care last. Perineal care involves cleaning the private parts, or the genitals and anus. Perineal care. 1. Protect the bed with a waterproof pad under the resident's hips. 2. Lift the knees so the resident's feet are flat on the bed. For females, spread the folds of genital skin, labia, apart and wipe each side from the front toward the back in one motion. Use a clean part of the cloth for each side. Replace the cloth as necessary. Repeat until clean, then rinse and pat dry. For males, lift the penis and wipe around the tip in a circular motion, then rinse. Wash the shaft of the penis by wiping from the tip to the base and rinsing. Wash and rinse each side of the scrotum, testicles, and the inside of the thighs. Pat everything dry. Anal area, sometimes called the rectum or rectal area, turn resident on side, facing away from you. Wipe the anal area from the front of the genitals toward the back in one motion. Wipe first with toilet paper, then wash one side at a time with a clean area of the washcloth. Replace the washcloth as needed,